wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome back to our program today. We have as our guest Dr. Blanche Grube, who was on a previous broadcast, so this is really episode 2. And we're going to discuss dental health and oral hygiene because as a physician, it's come to my attention over the years and more recently through Dr. Grube's work and Hal Huggins' work and Weston Price's work, these 3 dentists who are really giants coming out and exposing the problems that cause systemic and chronic disease and how they're derived from procedures done by dentists and from infections in the oral hygiene and in the teeth. And so we talked last time about Dr. Grube, who is a biological dentist out of Pennsylvania and South Carolina, who's been in practice for 40 years. And she was a disciple of Dr. Hal Huggins, and in our first broadcast, she explained how she met Dr. Huggins, who lived in Colorado Springs, and he made a diagnosis of her on a blood test that she had chronic leukemia, and asked her if she had had root canals, and she didn't know what to say. How did he know she had had root canals? And Dr. Huggins said, "I have never met a patient with cancer that didn't have a root canal." And so over time, a period of several months, Dr. Grube had her mercury amalgams removed, and she also had her teeth removed in which she had root canals, 5 of them removed. And guess what? She's alive today, 40 years later, and her blood completely cleared up, and she didn't develop full-blown blood disorder and blood cancer. So this is a great story about the importance of dental hygiene and dental health and how it contributes to systemic disease in the body, which, as I mentioned in our last program, most physicians, in fact, very few physicians, ever think about oral hygiene and dental health as a cause of systemic health problems. And we're going to talk in detail on why these dental procedures and dental problems and teeth infections, how they lead to systemic disease. One of the most common problems caused by dental infections and teeth infections, root canal infections, and cavitation infections is heart disease, but it can cause disease throughout the body. It causes chronic inflammation. And chronic disease is caused by chronic inflammation. So when you have bacteria, anaerobic bacteria that don't need oxygen, breeding in the root canal tooth, breeding in cavitations, breeding in periodontal disease of the bone, when you have these bacteria breeding, they give off toxins, and they also seed the blood, and they go to various organs, and they can cause this chronic disease and inflammation, which the body can't get rid of. So there's chronic inflammation, and we know that chronic inflammation is a leading cause of heart disease, strokes, diabetes, kidney disorders, and a host of other medical problems. And so the question is, what's causing the chronic inflammation? And most doctors say, well, we're not sure what's causing it, but you got it. And if it's in the heart, they want to do angioplasty or they want to do a stent or they do bypass surgery. And they give you a statin drug as if cholesterol is causing the problem, which is not causing the problem. Cholesterol is a Band-Aid to patch the problem, which is chronic inflammation of the endothelial lining of the artery caused by an infection. And the infection, based upon studies of the plaques in the heart, are anaerobic bacteria from the teeth and from periodontal disease and from cavitations. And so you must have yourself evaluated by a biological dentist, and they have special X-ray equipment that they can see where the problem lies. And so let's just jump into it. We talked in the last episode, we talked about mercury, and I wanted to just go over some facts with you about mercury. Mercury, as you are well aware, is highly toxic. It's one of the most toxic elements in the world. And right now they have banned thermometers with mercury in them. You're warned about eating fish with mercury. The European Union on January 1st of this year banned all mercury amalgams throughout Europe. You can't, they're disallowed, no longer able to do them. Why in the world do 50% of the dentists continue to use mercury, which according to the material safety data sheet by the federal government is carcinogenic? And so the mercury amalgams, people know them as silver amalgams. If you got a silver, if they've taken care of a cavity and put silver filling in there, that's made up of 50% mercury, 25% silver, and then also tin and zinc. That's what's in that, but at 50% mercury. And every time, and mercury's highly toxic. Why in the world would you put mercury in your body? When they deal now with mercury in dentist's office, they're required, if they remove mercury, it has to be disposed of as a biological waste and as a toxic waste. You can't just throw it in the trash can. You've got to have special procedures and filtration system in the room to prevent the people in the room that are assisting the dentist and the dentist from inhaling the mercury vapors. Every time, if you have mercury amalgams, every time you chew, every time you brush your teeth, every time you bite down, mercury vapors are emitted, and they go into your brain, they get into your bloodstream, they go to all organs of your body, and mercury binds to proteins, it binds to enzymes, it binds to fat, and it binds to fat in the brain, it binds to fat on the nerves, the myelin sheath. So it's very likely that people that have Alzheimer's disease, that have dementia, that have neuropathies, neurological disorders, multiple sclerosis, and a host of amyotrophic lateral disease, which is Lou Gehrig's disease. These may indeed be caused by the mercury that builds up in your body. Mercury is very poorly excreted, and it builds up in your body over time. It's insidious. It doesn't happen overnight when you put it in a mercury amalgam. It takes years and years, decades, for the mercury, every time you chew or brush, for that mercury to build up in your system, and it binds to fat cells, to adipose tissue. And that adipose tissue is what covers the myelin sheath, and that can cause these neurological problems. And I've never heard any doctor ever explain the potential of Alzheimer's disease or dementia or multiple sclerosis or any neuropathy as being potentially caused by mercury poisoning from the teeth, which is obviously got to be one of the major problems in causing these neurological disorders, as well as they bind to the proteins in the mitochondria, and they're going to cause mitochondrial dysfunction. The mitochondria is the power plant of the cell, and you're going to produce lower energy, and it's going to bind to the fat lining the cells, so you're not going to get the nutrients and the vitamins and minerals your body needs into the cells, because the mercury is adversely affecting the receptors and the ability of cells to properly assimilate these various vitamins, minerals, and nutrients. So mercury is a big, big problem, and why anybody would ever put mercury in a patient's mouth, I can't imagine why. And I think but there is a reason for that. And tell us about guess who owns the patent? Tell us, Dr. Grube, Who owned the patent starting in 1977 on mercury amalgams?
An organization that some people might have heard about. It's called the American Dental Association Health Foundation. It used to
Well,
be the American Dental Association that owned all of the patents on amalgam. Then they transferred it and they formed a new organization called the American Dental Association Health, that's funny, Health Foundation.
right.
They own all of the patents on mercury amalgam. And I don't think in this program I want to get into the nefarious reasons why they make money off of all of the amalgam that is sold worldwide.
Mm.
I'm not so sure I want to get into that right now because
Well,
I want to live.
well,
But
well, listen, if something seems inexplicable, if mercury is highly toxic and dangerous, and the dental societies are promoting the use of mercury amalgams, and we know it's toxic, highly toxic to the body, as my dad said, if something doesn't seem right, why people do certain things, always follow the money trail. And
follow the money trail.
there's a money trail there. And so and it's the same way in in the practice of medicine. Why do the doctors promote all the pharmaceutical drugs? Well, the pharmaceutical companies underwrite most of the medical conferences, most of the medical journals have all the ads in them. They help underwrite medical schools with grants, and physicians are indoctrinated in the use of pharmaceutical drugs to mask symptoms and problems rather than treating the underlying cause of the problem. And what I'm telling you in this broadcast, it may be that your underlying cause of your problem may be some of the dental procedures that you've had done during your life. And that's something you need to consider, and that's why you need to be evaluated by a biological dentist. As I mentioned, these dental diseases, these dental oral cavity lesions and dental lesions caused by gingivitis, caused by periodontal disease, caused by root canals, caused by mercury amalgams and cavitations, they can seed your body with bacteria. And this can cause a host of health problems, even cancer. The toxins that are in it, they can cause cancer in your body. So if you have any of these health problems, that's why it's so important for you to go see a biological dentist who practices what we call the Huggins Grube protocol. So talk to us about that.
I'm sitting here listening to you in amazement because you know more than 99.99% of all of the physicians in the United States. Most physicians cannot articulate all that you just articulated about biological dentistry and how it affects our health. You just absolutely amaze me. But everything that you said is absolutely true. What's interesting is that, yes, the American Dental Association has always and still to this day has a vested interest in the use of amalgam. They know that the time is coming quickly to an end, but they're still fighting, and they're still fighting people like me. I was going to save this part for the end of the lecture, but I think I'll tell everybody right now that Hal Huggins was attacked by the American Dental Association after he published his book. It's All in Your Head. This book came out in 1984, where he kind of blew the lid off the whole mercury amalgam thing, and he thought that the American Dental Association was going to be so happy with him. In fact, just the opposite happened. They made the decision that they were going to get rid of him, stop him, and do everything they could possibly do to keep him from spreading his message. And they did that. In 1996, they suspended his license. They took his license away, as they did for many, many other dentists. And yes, you said I was a disciple of Dr. Hal Huggins, and just like the disciples of Christ, they were also martyred. It was, yes, Christ died for us, but so did the disciples. I think all but one.
Right.
Only John on the island of Patmos. He's the only one that was not tortured and
Killed.
and martyred and killed and martyred for us. Well, as a disciple of Hal Huggins, the state board decided last year, so this was January 16th of 2024, they sent me a letter letting me know that they had suspended my license. Of course, there was not a single patient complaint, not one, not a single patient complaint. I never got a hearing. I never, I thought in the United States you were innocent and you were allowed to have a hearing in front of your peers until proven guilty, but that's not so.
And they challenged you on the removal of mercury amalgams and also on the removal of root canals. So, and you've been practicing that for 40 years.
Yes, perfectly good mercury amalgam fillings, and I was extracting perfectly good root canal teeth. Those are both oxymorons. There's no such thing as a perfectly good mercury filling. There's no such thing as a perfectly good root canal. And so here we have, on one half of the world is banning the use of amalgam fillings, and on this side of the Atlantic, they're literally crucifying me, taking away my way of making a living, and suspending my license for doing the same thing that is law on the other side of the Atlantic Ocean. How can they possibly tell me that I should not be taking out amalgam fillings? I don't get it.
Well, I want to encourage the listeners to write this down. There's a wonderful YouTube which demonstrates the vaporization of mercury in the mouth. And it's done by Dr. Oz. And so you can type in YouTube, Dr. Oz, O-Z, exposes the truth about mercury fillings. And he had a demonstration where they had a glass box that was perfectly sealed, and they had teeth in it in a makeshift mouth that had mercury amalgams in it. And they measured the mercury before, and there was 0 mercury in the air. He put his hands in the gloves, he got a toothbrush, and he started brushing the teeth, and it immediately shot through the ceiling. 61. And Dr. Oz said, well, is that bad? And he said, and the doctor that was with him said, if you have 1%, that's bad. And that just showed how quickly the mercury vaporized when they brushed the teeth. And so that happens every time you brush your teeth or bite down, you're releasing mercury in your body, which is highly toxic. And there's no reason for you to have that in your mouth. I, for one, when I first heard about this, maybe 20 years ago, my wife and I both went and we went to a biological dentist. We got our mercury amalgams removed, and that was done. So I feel good about us having done that.
But you went to one of the best biological dentists in the country, so you were very fortunate. I have to remind your listeners, do not go to your dentist across the street, your dentist down the block, who says to you, oh, you want your fillings taken out? Sure, I can take your fillings out for you, no problem. No, do not do that. You must go to the IABDM. I'm going to say that again, IABDM.org website, and pick one of the dentists that is certified as a biological dentist. They know what they're doing. Each one of them has been tested and has proven to us that they know how to take mercury amalgam fillings out properly. If you go to a regular dentist and they just start drilling on your teeth, you're going to have more mercury in your body than you would have ever had you done nothing. So those are your two choices. You either do nothing or you go to a certified biological dentist and have them taken out properly.
And that's
emphasize that.
It's IIABM.
the International Academy of Biological Dentistry and Medicine.
Say the initials again.
IABDM.
IABDM. IABDM.
All right. There's another organization, again, 5 letters. IAOMT. That's the International Academy of Oral Medicine and Toxicology. And even in that organization, go to somebody who's what they call SMART certified. SMART meaning they know how to remove amalgams properly. In IABDM, we call them Protect certified. I don't know why everybody has to come up with a cute name. They're just certified. They know what they're doing. And so that is just so important. You might have to pay a little bit more money going to these people than your dentist across the street. But we're talking about
your health.
We're talking about your health. You're keeping yourself from forming an autoimmune disease, forming cancer, something really serious down the pike. It's worth every penny. If you're going to have your fillings taken out, save up your money, have it done the right way, or not at all. Those are your 2 choices. I just can't help but emphasize that enough. Another thing about you were mentioning before that mercury can cause Alzheimer's, Lou Gehrig's disease, Parkinson's,
multiple sclerosis. Yeah, Parkinson's.
Multiple sclerosis. Well, in the scientific community, when they want to study a disease, they find something that will cause that disease, and they introduce it to the mice, to the rabbits, to whatever animals that they're looking at. Well, when it comes to ALS and MS, the only way they could cause the plaque on the brain was with mercury. And these studies were done by Dr. Boyd Haley, who was the head of chemistry at the University of Kentucky. The only way they were able to reproduce the plaques that you see in Alzheimer's disease, the plaques that you see in Parkinson's, the only way they could reproduce that was if they introduced mercury into the brains of these poor little mice, and they wound up coming down with these diseases. It was only mercury, and of course he came up with a product that could actually remove the mercury from the brain safely. And the FDA came and shut him down and put an end to that. So I'm really looking forward to, Robert Kennedy Jr. getting approved.
Amen.
And being the next head of HHS, because we desperately need to get away from the kind of system where if you tell the truth, you're banned. If you tell the truth, you're harassed. We got to get away from that kind of system and get into a system where you say what you need to say and let the science prove it one way or the other.
Let the people decide. They can do. Look, people are smart. You can go online. Some doctors go, well, you saw that online. Well, yeah, you can get all these medical articles online, peer-reviewed articles. Literally hundreds of thousands of articles on any kind of disease, and you can become more educated about a disease than your own doctor. You can learn more about it because most of these doctors are specialists. They only know their one specialty. If they're gastroenterologists, they don't know all the details about heart disease. If they're kidney specialists, they may not know all the stuff about the microbiome and the gut. They don't know everything, and no doctor does, but if you have a specific problem, you can go and investigate it, and I would always start with the relationship between oral health and dental health and chronic disease. Listen, Dr. Weston Price wrote 2 books on degenerative dental infections and the degenerative diseases. He wrote 2 volumes on this. He wrote it back in the 30s or 40s. And all this research has been done, but because it conflicted with the direction that dentistry was going, with the doctors that were trying to promote root canals. By the way, I think there's somewhere on the order of 15 million root canals done every year. It is a $38 billion industry in the dental profession. So if they quit doing root canals, cost a lot. They would cost them a lot of money. But what is the alternative? Let's talk about that. What leads a doctor? Okay, we know about cavities. If you have gingivitis, gum disease, or you have periodontal disease, and often you're going to develop and you'll have cavities in your teeth, and that's from a poor diet, a high sugar diet, a lot of simple carbohydrates. Americans eat poorly. Studies have shown, Dr. Price showed, indigenous people around the world that eat their standard diet that they've eaten for centuries have no problems with their teeth, no dental problems, no problems with gum disease. Their teeth are perfectly healthy. As soon as they adopt the standard American diet, high in sugar and simple carbohydrates, their teeth just deteriorate. So we know that it's so very important for you to adopt a healthy eating plan. Healthy meats, vegetables, and the meats would include beef or lamb or fish. And if you can, get yourself grass-fed cattle, and you can get that if you live. People outside, if you live in a metropolitan area, you can Google that. There are people in surrounding areas, in the rural areas, that sell steers that are grass-fed and not vaccinated, and that's what I'd highly recommend. And that's what I've done on our place out in the country. We raised our own steers, we slaughtered them, and they were all grass-fed. They didn't get vaccinated, and they're delicious. So, and eat vegetables and salads, and that's what you need to do. And good oils, butter, real butter, not margarine, and stay away from all these processed salad oils. Use olive oil, and then take cod liver oil or fish oil. All those are very important for brain health and for the health of the entire body, to have good, healthy oils in your body. So your diet is very, very important. Your eating plan, and you have to eat to live and not live to eat. And most Americans live to eat. So let's go back on. So we've talked about mercury amalgams and the dangers of mercury. In the earlier program, we talked about gum disease leading to periodontal disease, which is the infection at the base where the root of the tooth meets the bone, and it gets infected from the gum disease, and then it breaks down and the tooth gets loose, and people end up losing their teeth over that. And then people have tooth pain, and they go to the dentist, and dentists will often say, as you said, you need a root canal. Now, what would make a doctor explain to me, and I'm not a dentist, is it when you have a cavitation they do a root canal, or do they normally fill it? Or what leads a dentist to say you need a root canal in conventional terms?
A dentist will say you need a root canal if the pulp of the tooth is non-vital, if it's already dead.
Okay.
It's already been infected by decay. The pulp of a tooth can die from trauma.
Right. Well, how does the dentist know that the pulp is dead? Do you have a cavity, and how do they know the tooth's dead?
You can have a cavity that extends all the way into the pulp.
And
It's a dark circle, and that dark circle extends all the way into the pulp of the tooth.
Now, is that seen on an X-ray?
They can see it on an X-ray.
Okay.
Or they look at an X-ray of the tooth, and when they look at the bottom of the tooth, well, if it's an upper tooth, they would look at the top of the tooth where the root ends. If they see an abscess there, then they'll tell you that the tooth is dead and you need a root canal. Or if there's so much decay that it's in the pulp of the tooth, they'll say you need a root canal. Or if the tooth is so badly broken down that they can't fit a crown over it and have enough space for that crown to fit between that and the opposing tooth, sometimes they'll do a root canal even on a live tooth just to make enough room to put a crown on.
Okay, so if if you have a dead tooth, you've got the root canal is dead, the cavity's extended into the root canal, you have an infection in there, and the doctor says you need to have a root canal. A recommendation from a biological dentist would be to have it removed.
Correct.
Okay.
They say no.
And then put a bridge.
Well, it depends on the biological dentist. I would say you either put a bridge there or you put a partial denture there.
Okay.
That's what you do to replace the tooth that's missing. Some biological dentists now have gotten on the bandwagon and they're all doing implants because they have been told that zirconia implants are safer than titanium implants. Historically, implants were always made out of titanium, and there's no such thing as pure titanium. It would always be a mixture of titanium and other metals. Historically, all implants were made out of titanium plus other metals. Then they came up with the zirconia implants. Now, what is zirconia? It's interesting. It's the closest thing to alchemy that we have in science and in medicine. Alchemy is where one element gets actually converted and becomes a totally different element. You and I, Dr. Hotze, when we were in chemistry, we were taught as young students that the elements are the elements because they can't be broken down into anything else and they can't be changed into anything else. This is what life is all about. And we know now that that's not necessarily true, that elements can be converted, not just the titanium, but other elements. And so they take a zirconium, ends with they take a zirconium metal bar, put it into an oven with very, very high temperatures, well over 200 degrees Fahrenheit, and a tremendous amount of pressure. And it pops. It's kind of like making an instant diamond. And when they were first able to do this, they actually had commercials on TV that people could buy a zirconia diamond ring, and the average person couldn't tell if it was a real diamond or if it was zirconia. So that zirconium, that was a metal, pops, changes into zirconia, which is a crystal. And it behaves like a crystal. It does everything that a crystal does. And so the dental profession got on the bandwagon and said, you know what? We can make these implants now out of this crystal. And because it's a crystal, we don't have any of the problems that metals have in the body. And this is a good thing. Unfortunately, even the zirconia implants are coated because if you want the bone to attach to this thing, you got to have aluminum and aluminum oxides. It's the only way it's gonna attach. So it's a zirconia implant, but the outside of it is all aluminum oxides. Mm-hmm. So not necessarily a good thing. But my biggest concern with implants is that they are foreign to the body. In other words, and I'll show you why is that important? Because every cell in your body, every single one, has something called the histocompatibility complex on its surface. And Dr. Huggins used to say it's kind of like your license plate. So my license plate is made up of the letters BLANCHE. Every cell in my body says Blanche on it, BLANCHE. So if I put something in my body that does not have those letters on it, that's my histocompatibility complex. And my body will immediately recognize it as not Blanche. And then it sets into action what the immune system is designed to do, and that's to get rid of anything that is not Blanche. Mm-hmm. So when you put a zirconia implant inside somebody's bone marrow, by definition, it has to set up an immune response. That is the nature of the body. You can't change that. It's the way God designed us.
Right.
It's a foreign substance. You're going to set up an immune response. That immune response is going to steal energy from you. it's going to steal white blood cells from you, and you're wasting them because those white blood cells cannot push that implant out of your body. It's way too big. And so then when something important comes down the pike, and you're going to need a certain number of white blood cells to fight whatever it is that just came down the pike, you're not going to have them. You're not going to have what you need to fight whatever it is you just came in contact with, because you've been wasting white blood cells on trying to get rid of that implant. Same with root canals. If you leave the root canal in your head, your immune system is constantly fighting that foreign, the toxins that come out of the root canals, the chemicals that come out of root canals. Sometimes the root canal itself, the bacteria. Sometimes the root canal filling itself is sticking out at the end of the tooth, and the body has to fight to try to get rid of it. And so, people don't understand that our immune system is a finite system, meaning the day you were born with just so many mature white blood cells, and that's it. That's all you get. And if you want to use them all up when you have a root canal or an implant in your head, that's fine. It's a free country. You have the right to do that if somebody's already explained to you that that's what you're doing. You're going to shorten your life. If you want to do that, go ahead. You want to drink, smoke, all kinds of crazy things people do.
Well, when you put in normally they'll put in the implants immediately after they take out the root canal, and I've got to believe if they haven't cleaned out if they pull it out, they haven't cleaned they don't clean it out when they put it in there, then you're going to still have some dead tissue, and bacteria are going to still form around the base of the implant.
Now, the biological dentists, they've been trained to clean out the socket. So they think because they take a piezo instrument or a spoon explorer or a drill and they rotor that whole socket, they think, wow, I got it all. It's nice and clean. Now I can go ahead and put some artificial graft material in an implant. No, you didn't get all of the bacteria, because the bone around that socket is a sponge.
Right.
It's absorbed some of that bacteria. You've got to give the body time to get in there and with white blood cells, get in there and take care of whatever toxins or whatever bacteria have escaped from that toxic tooth. So if you're sticking in an implant the same day, you got problems.
I've seen some so-called biological dentists that have promoted the fact that they use lasers after they do a root canal to kill all the bacteria. What is your thoughts on that? You've seen that.
I think it's very funny. I guess this is the part of the show where we have a little comic relief, right? Because that is very, very funny. Lasers, as far as I understood, and I took some physics courses, lasers travel straight. They do not bend. They travel straight. The dentinal tubules bend. Right. They go 45 degrees this way, right. They make a left, they make a turn, they go in every which direction.
And every tooth has 3 miles of approximately 3 miles of microtubules. 3 miles of microtubules.
It's not straight. If it was straight, your dentinal tubules would stick out 3 miles from your mouth. That is so funny. So yes, you can put a laser down the middle of a canal, and maybe the major canal is straight, but most of the time they're not. You're not going to do a thing for the lateral canals, the ones that make a right turn and a left turn and 45 degrees, and this one's 30 degrees. You're not doing a thing for that. You're still going to have bacteria in there.
Well, let's talk about teeth cavitations, and that's when you pull a tooth. For instance, like wisdom tooth, 85% of Americans, according to my readings, have had their wisdom teeth removed. 85% of people in indigenous countries, which have perfect teeth, none of them had their wisdom teeth removed. So, and of course, it's almost like a rite of passage. I think I had a wisdom tooth pulled. I think I did. I'm going to go to a biological dentist and get some x-rays and see if I've got cavitations in there. But it can, they can heal over on top, so everything seems fine, and you have no pain. You and it may be that sometimes that you don't develop a cavitation, or do you think every time a cavitation develops when you remove a wisdom tooth or another molar or another tooth?
Oh no, not every time. There are some people who can still heal even though the wisdom tooth was taken out. Usually, if the dentist doesn't use epinephrine in their Novocaine, you have a much better chance of that socket healing. It's when the dentist uses Novocaine with epinephrine that a lot of the blood vessels have contracted, a lot of the bone cells have died because they're not getting any oxygen, and that's the beginning of the form of cavitation. A lot of people think cavitations form because the dentist didn't remove all of the ligament that held the tooth to the bone. Now, that's part of the picture, yes, but more importantly, it's if the dentist uses epinephrine. Epinephrine is a vasoconstrictor. Dentists love it because the patient stays numb for 2 hours. Dentists love it because the patient doesn't bleed a lot. This is just great. That's why dentists love it and use a lot of epinephrine. But it's not good for the bone. It's not good for the bone. It kills a lot of bone cells. And then when the dentist puts the cotton in the patient's mouth, they expect them to go home and make new bone. And it just doesn't happen because new bone only comes from bone cells that are alive. If they're dead, they're dead. They do not reproduce and make new bone cells.
And this
So
is
that's
where
the biggest problem. That's the cause of, I believe that's really the real cause of cavitations is the use of epinephrine.
and epinephrine, folks, in lay terms, would be adrenaline. It's made by the adrenal gland, but it's also known medically as epinephrine. So once you shoot lidocaine, which is a deadener, and epinephrine, which causes the blood vessels to constrict, then that tissue dies. I'm talking about the bone tissue dies. And it can be, and maybe you have some ligaments they haven't cleaned out properly when they remove the tooth. But that dead bone tissue is a breeding ground for anaerobic bacteria as well. Isn't that right?
That is correct. And so that's the beginning of the formation of a cavitation. And it might take 20, 30 years before there's so many toxins now in that cavitation, in that space, that the patient begins to get symptoms. It doesn't happen overnight.
Right. And so if you see a biological dentist, they can do specialized, it's not the regular dental x-rays, there's some kind of CT. Tell me what type of.
Sometimes you can see it in a regular dental x-ray. And I've looked at many bite wings and I can see a cavitation there in the corner. But most of the dentists now are using something called a 3D x-ray, where they do a scan of the whole head. And this is a computer-generated picture of your whole head, and it gives the dentist the ability to slice it in every direction. They can slice it from front to back, from side to side. They can slice it diagonally if they want to. But because they can slice it in all these different directions, they can immediately see the shape of the bone, and where suddenly there is no bone, there is no bone marrow, there's a void. And they come up with the diagnosis and say, yes, you have a problem here. There's a radiolucency, meaning darkness in the bone. And the only way you can tell if that bone is infected or not is by doing the surgery, by doing a biopsy, by taking a sample, sending it to DNA Connections and finding out what microorganisms are inside that hole. It's the only way you're going to know.
Okay, that's something that we hadn't talked about. I know there's a lab, and I don't know whether you still are part owner in the lab or involved in that lab at all. It's in Colorado Springs, and so what material would a biological dentist send to that lab, and what would the lab be looking for, and how would that change the way the dentist or physician treats the patient?
Well, what the dentist does is they make an incision into the gums. They move the gums off to the side. They drill a hole through the cortical bone, which is the hard outside bone, and they literally will fall into an empty hole. Sometimes it's empty, sometimes it's not empty. Sometimes there are goobers in there. That's what I call them. My nephew likes to call them snot packs. There's all kinds of gunky stuff inside that cavitation. And so that's the part that the dentist will scoop out and put into a test tube and send to DNA connections. Sometimes they'll take a little piece of the surface of the bone and send that to DNA connections. And then they send another part of the bone to another laboratory that does a pathology exam. That's totally different. The pathologist will look at the bone cells and come up with a determination based on the structure of those cells. So they'll say it's osteomyelitis or osteonecrosis.
By the way, osteo means bone, myelitis means infection of the bone.
Right. And osteonecrosis means
dead
bone.
Dead bone.
Right. So they will come up with a diagnosis of osteomyelitis or osteonecrosis. DNA connections will come up with the list of microorganisms that were inside that cavitation. So as you said before, most of the time, the bad boys are what we call the anaerobic gram-negative microorganisms. These are microorganisms that do not need air to breathe. And in the past, it used to be very difficult to get a sample, take it out of the mouth or the body, put it in a petri dish, and grow it. You couldn't do that.
Couldn't do it because it was
you exposed
anaerobic.
It to air. Right. Yeah, you exposed it to air, and that was it. They're anaerobic, so the moment you expose them to air, they would be dying. But now, and again, it was the genius of Dr. Hal Huggins. When he discovered that we could look at DNA, he thought, well, wait a minute, then we can look at the DNA of a root canal tooth. We can look at the DNA of a cavitation. We can look at the DNA of the gums. And it doesn't matter if they're anaerobic because the DNA doesn't change, even if it's exposed to air.
So basically what that does is simply prove that there is anaerobic bacteria in a cavitation or in a root canal, which just underscores our point that these root canals and cavitations are a seedbed for anaerobic bacteria, and this simply proves that. So the way to treat it, obviously, if you have a root canal, take the tooth out, put a bridge in, and make sure you go to a biological dentist to do that, who's going to clean out the base of the tooth and get rid of all the ligaments and any other tissue that on which anaerobic bacteria could grow. And same thing in a cavitation. You want to make sure that gets cleaned out well. So you want to go to a biological dentist. You don't want to go to your regular dentist who maybe gave you the root canal to begin with or who pulled the tooth to begin with. So we know, too, interestingly enough, the third molar, which is your wisdom tooth, meridian goes to the heart.
Right. Now everybody knows what a meridian is. So, this is where President Nixon going to China and one of his assistants, I guess in his entourage, had an appendicitis attack while they were in China. And they rushed this fellow to the hospital, and without any sedation, without any general anesthesia, they did acupuncture. They made a slice and they took out this fellow's appendix. He was wide awake for the surgery. They did this with just acupuncture. President Nixon was so impressed that it's because of him, because this happened, that he actually brought Chinese acupuncture system here to the United States. And people began to understand that the Chinese had mapped out the meridian system of the body thousands of years, not hundreds, thousands of years, while in Europe, Leeuwenhoek had just invented the microscope. We had just started taking apart the body and started naming the nerves, the blood vessels, the muscles, the things that you could see and feel and touch with your hands, or you could see them under a microscope. That's where Western medicine was. Eastern medicine was looking at the energy patterns. So the Chinese knew way back when, so we're talking 6,000 years ago, they knew that the heart meridian started at the pinky, traveled up the outside of the arm, swirled around the wisdom tooth, then went down to the heart, swirled around the heart, went back up to the wisdom tooth, and came back down the arm. That was the heart meridian, which means it was an energy pattern that is constantly moving. So there are 12 major meridians in the body, 12 minor meridians, and these 24 meridians are constantly moving. It's what makes up our chi, what they would call, that's the term that they use. Our chi is our life force, the energy that we have. Some people will go so far as to say our chi is really, our spirit, our soul. I'm not so sure about that. I think it's a physical phenomenon. We are
Right.
energetic beings. And so every tooth in the mouth has a meridian that is associated with it. So if you have a heart problem, you need to look at your wisdom teeth because your wisdom teeth are directly connected to the heart.
So if you got a problem, if you have a problem in the in Chinese medicine, using the idea of energy meridians, if you had a problem with your heart, you would expect that you would find a problem with the wisdom tooth. Either it's been pulled and you got a cavitation or you got a bad wisdom tooth.
Right. But then you still have a problem with the heart if there's a cavitation there, even though the
That's
tooth has been taken out. Right. If you have prostate problems, take a look at your front teeth. If you have ovarian problems, take a look at your front teeth because these are the teeth that are attached to our sexual organs. Remember I said in my story about looking for a woman with breast cancer who didn't have a dead tooth in the bicuspid meridian.
right.
Why did I say that? Because the bicuspid meridian and the upper first molar is what goes to the breast. Every time.
And she ended up having a dead tooth.
That's right. She had a dead tooth. Even though it was her canine, the eye tooth, it was lying sideways above her two bicuspids. It was in the bicuspid meridian, or as we would say, the breast meridian.
Well, just you bringing this up, I need to bring on somebody. I've read cursorily about the meridians and about acupuncture, and I've never, I don't understand it or can't explain it, and couldn't. I only know what I've recently learned about the meridians from the teeth to different organs in the body, and so I know there's certain pathways, and I need to do some more study on that. Bring on somebody who's an expert in that field and discuss it because it's fascinating, really, and it could have a profound effect on helping our guests, our patients, get on a path of health and wellness naturally. Well, we've discussed oral hygiene and dental health and its profound effect it can have on the health of an individual. We know that if you have gum disease, if you have periodontal disease, where the gum disease has infected the base of the roots of the teeth and caused the bones to become infected, and they're infected with anaerobic bacteria that do not need oxygen, and they seed the body. We know that mercury, we've talked about mercury and the toxic problem that it causes in the body, and how it adversely affects all the cells of the body because it attaches to proteins and it makes them dysfunctional. It attaches to fat, which lines all the nerves in the body, the myelin sheaths, and it can cause a host of health problems. And we also talked about root canals and how you can't possibly get a root canal and think that you've got a sterile tooth. You've got a dead tooth in your mouth, and within the 3 miles of microchannels and tubules inside your teeth, you got anaerobic bacteria that are excreting toxins and are seeding the body and getting into the bloodstream. And then finally, the cavitations from a pulled tooth, it may heal over on the top, but if it wasn't done correctly, then you can have a cavitation where you've got infection in the bone where the tooth came from, because the doctor used epinephrine, and that cut off the blood supply and causes the tissue to die, and you get necrotic bone, and you get osteomyelitis in the bone of the tooth, or of where the tooth was pulled, usually the wisdom teeth. So these are 4 key areas where dental procedures can cause health problems systemically. One last thing I want to mention is the use of fluoride. Fluoride is highly toxic. You can go to the material safety data sheet, and it is highly carcinogenic. Fluoride, in the 1950s, there was a big fight about whether you should put fluoride in the waters, and the aluminum and fertilizer industries had all this toxic fluoride they couldn't get rid of. And somebody did a study somewhere and found in water in one part of the country, well, they had less cavities, so the fluoride must be the solution to cavities. So they put in 70% of the municipal water supplies in America have fluoride in them. Now, fluoride is highly toxic. And it says on the side, and it's put in toothpastes, for crying out loud. When you see Crest, you go read on the side of the package. It says, keep out of the reach of children under 6 years of age. If more than used for brushing is accidentally swallowed, get medical help or call poison control. Help me, please. I mean, why would you put something in toothpaste that if you swallowed it, and by the way, when you swallow fluoride, only half of it gets excreted, 50% stays in the body, and it poisons the body. And it's very important in thyroid function. Your thyroid gland makes 2 primary hormones, T4, which is the thyroid molecule with 4 iodine atoms on it. 94% of the thyroid gland makes the T4, which is inactive thyroid, and the active thyroid is T3. It has 3 iodine atoms. Well, only 6% of the material made from the hormones made from the thyroid gland are T3. The T4 has to enter the cells. When it enters the cells, the deiodinase enzyme cleaves off one of the iodine atoms, and now you've got T3, the active thyroid hormone, which is like a spark plug, which catalyzes the production of energy in the form of ATP in your cells that drive all the biochemical reactions. So fluoride poisons the enzyme that converts T4 to T3. So in 1950, in the American population, about 8 or 9% of the people were obese. Today, it's somewhere on the order of 40 to 45% of the people are obese, 75% of the people are overweight. In Europe, they banned fluoride in the water. And if you go to France or if you go to Italy, only 9% of the people are obese to this day, and maybe 15% overweight. I've noticed, I've traveled in Europe, and I was always amazed at how thin all the people were. You didn't see a bunch of fat people around there. Well, thyroid governs your metabolism, and if you're poisoning your ability to convert the inactive thyroid hormone T4 to T3, you're not going to have the energy production. You're going to have low metabolic rate, low voltage. And when you have low voltage, guess what? Especially if you eat a SAD diet, a standard American diet, you're going to gain weight. And what are you going to do? You're going to end up getting diabetes, heart disease, strokes, fatty liver disease, kidney disorders, a whole host of problems. So,
and yet the state boards continue to harass dentists who are anti-fluoride.
Right. It's just it's absolutely crazy. And I've heard Robert Kennedy Jr. He's had lawsuits about fluoride, and they're going to take fluoride. His plan is to get fluoride out of all the municipal water in the country. And that's what he plans.
God bless him. I hope he makes it.
Yeah, we got to pray in Christ's name that he would be confirmed, and he's going to be. He has his hearings today, and of course, you're watching a broadcast that's being redone. So today is today is the day that they're going to look at Robert Kennedy, and hopefully by the time you see this broadcast, he will have been confirmed.
I hope so.
So anyway, now what can you do about fluoride? Well, filter your drinking water. We use reverse osmosis. Use non-fluoridated toothpaste. You can get something like Spryer. There's all kinds of non-fluoridated toothpaste, and there's no warning on the label because it doesn't contain fluoride. Also, iodine helps remove fluoride from the system, and we use on our guests iodoral. We take that, and that's an over-the-counter preparation. So those are some things you can do to prevent fluoride.
And limit the amount of beer and soda pop that you drink, because those products are made with fluoridated water.
Right, and most water you buy at the store, in the bottles, plastic bottles, which are dangerous in themselves because they have plasticizers, BCP, and a bunch of other chemicals in them. Most of those come from tap water. They just bottle the tap water. They're selling, the water's cheap. They're selling bottles is what they're selling. So stay away from that. Stay away from the fluoride. And I noticed every time I go to the dentist, the assistant comes in at the end of the procedure. Well, let me put fluoride on your teeth. I said, no, thank you. No fluoride on my teeth. Don't let them do that. Well, Blanche, we've covered a lot of ground in both episodes. And this is our second episode, and you've taught us a tremendous amount and brought to our attention the importance of good oral health and dental health in preventing systemic diseases, and how many of the procedures that dentists currently do cause many of the problems and the chronic disease problems that people have, and that dentists are unaware of that, or they've closed their eyes to it, don't want to hear about it because they have a financial incentive not to say anything about it. Besides that, the dental boards want to take away their license. And on the other hand, the physicians don't know a thing about dental disease. They've never heard about this. Very few of them, they never consider the possibility that poor oral hygiene or poor dental health could be contributing to the problems that their patients are experiencing, the chronic disease problems. So you brought this to our attention. I commend you for that, and thank you for your dedication to helping people get on a pathway of health and wellness naturally, so as they mature, they have energy and vitality and enthusiasm for life. Thank you, Dr. Blanche Grube.
You're very welcome. Thank you. Thank you for having me on.
It's a privilege. Thank each one of you for joining us today, and we look forward to seeing you back on our next episode. God bless you.
At Physicians Preference Pharmacy, we believe that personalized medical treatment and customized medications are the best way to help you achieve your healthcare goals. Sometimes this requires adjusting the dosage form of the medication from something like an oral capsule to a tablet which dissolves underneath the tongue. This is called a sublingual tablet. Sub meaning under, lingual meaning tongue, under the tongue. And there are several reasons why your doctor may want your medications to be custom-made into a sublingual tablet. Perhaps you have trouble swallowing capsules or difficulty absorbing medications. With sublingual tablets, you still get the treatment you need in a way that is effective for you. Tablets made here at Physicians Preference Pharmacy are designed to dissolve fully under the tongue in just a few minutes and offer an additional option for you to achieve your healthcare goals.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.